Happy day. I'm Dr. Paula Newsome.
And I'm registered nurse Tracy Young.
And together we're the educational faculty for KNOC Diabetes, where K stands for knowledge, N stands for nutrition, O stands for ocular health, and C stands for coaching.
So right now I'm going to walk you through some deep breath exercises. And this is very important to take some deep cleansing breaths throughout the day. You may be stressed out, you may have a challenging situation, and you just need to calm down for a moment. And so this is something that you can do anytime throughout the day.
Did you know that you can control your blood pressure by breathing? Did you know that you can de-stress by breathing? You know that you can actually not necessarily engage a lot of endorphins, but you can even change your mood by breathing. That breath is so very powerful. So this is probably one of the most important exercises that we can share with you.
Absolutely. So as we walk through these deep breathing exercises, I want to make sure that you're in a quiet and calm environment. Have a chair that has some back support, maybe arm support if you need it. Your feet should be placed flat on the floor with your legs uncrossed. And also, if you want to relax back in your chair to have your back supported, I'm going to ask you to close your eyes throughout this segment to get yourself ready for the deep breathing exercises. You're going to hear me say inhale and exhale and kind of give you a guide as to how long to hold your breaths and exhale. But I do want you to keep in mind to still do what is within your comfort level, especially if this is your first time going through deep breathing exercises. I want to make sure that you're also breathing in through your nose and exhaling out through your mouth. And as we go through the exercises, I'll make sure to guide you. So let's go ahead and get started. So close your eyes, and here we go. Take a deep breath in, 2, 3, 4, and exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4, and exhale, 2, 3, 4, 5, 6. Inhale, make sure you're inhaling through your nose, and exhale, blowing out that cleansing breath through your mouth. And inhale again, and exhale. Inhale, and exhale. Inhale through your nose, and exhale through your mouth. Inhale and exhale. Make sure you keep your feet flat on the floor. Inhale. And last one, exhale. Wonderful. How do you feel?
Excellent.
Right?
Excellent.
It's such a great exercise that you can practice at any time to kind of help yourself be calm and come down from any kind of stressful day or an event that you're having, or just to kind of clear your mind of any negative thoughts you may be having.
I actually even inhale and exhale even slower. I even just kind of relish that breath. So I even do it at a slower count.
Absolutely.
Because my day is so hectic that I don't want that same speed. I want to
slow
really,
it down.
Yes.
Absolutely. So you can do these exercises at your own pace. It is important to have your exhale be a little bit longer than your inhale to really blow out any of that negative energy or any of that old air that's kind of circulating through your lungs. So thank you so much for watching these breathing exercises.
We want you to be well,
stay healthy,
and stay the course as we knock out diabetes.
Happy day and welcome to our program, Knock Out Diabetes. I am registered nurse Tracy Young, and I'm here today to walk you through our weekly exercise regimen and introduce you to our Knock Out Diabetes community. One of our program goals is to increase your activity to 150 minutes per week. That breaks down to about 30 minutes a day, and you can get that 30 minutes in each day by breaking that down in 10-minute increments after each meal. By exercising after each meal, that will give you really good effects on helping to lower that blood glucose throughout the day. I do want to give you a couple of reminders before we get started. Make sure that before you start any exercise program, you do consult with your healthcare provider. You want to make sure that you adjust your medication appropriately, as exercising does bring down your blood glucose numbers. You may have any snacks that are needed to combat any hypoglycemia or low blood sugar. You want to make sure that you have a bottle of water or something next to you so that way you can stay hydrated. Some symptoms of hypoglycemia can include shakiness, feeling dizzy, blurred vision, or being excessively thirsty. So please be mindful and pay attention to your body and your body's cues as we go through the video. You can pause this at any time and make sure that you work at your own pace. Let's go ahead and get started. So first we're going to start with our warm-up. It's very important to do a warm-up. That way you can get your body ready for the exercise that we're getting ready to do. And warm-up is going to include exercises that are very low intensity just to get your muscles and your body ready for movement. Our first warm-up exercise is going to be the shoulder squeeze. We're going to squeeze our shoulders to the back and we're going to do 10 reps. Let's get started. Very good. Our next exercise will be exercising our neck. And we used to do the neck roll, but now we're going to take one ear and touch it to the shoulder and do that on the opposite side as well. And then take our chin and put it to our chest and then also move our head to the back. So we'll go ahead and demonstrate that. Let's get started. Again. Again. One more. Excellent. The next warm-up exercise we'll do is arm circles. You're going to have your arms right out to the side of you. We're going to circle 25 seconds in one direction and then 25 seconds in the opposite direction. Let's get started. Forward. And backwards. And arms down. Great job. Make sure that you take time to see how are you feeling. Take a check-in whether or not you need to take a break, hydrate with some water, or continue going. You can pause this video at any time. Our next warm-up exercise is going to be high knees. And for this exercise, you will hold your hands out in front of you and touch your knee to your hand for each repetition. If you are unsteady or you need a little bit of support, you can use a wall next to you or you can use a chair. For this exercise, we will do 20 repetitions. Let's go ahead and get started.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
Great job. Our next exercise is going to be side stretches. And for this exercise, we are going to stretch to one side. We're going to do that 5 times and hold each repetition for 5 seconds and then do it again on the opposite side. So we're going to start going this direction first. Let's get started. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Opposite side. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Very good. Now that we're finished with our warm-up, we're going to move into our exercise pieces. Our first exercise is going to be the good old sit-up. So we're going to sit on the floor with your feet flat on the floor. And if you need anything to hold your feet down, or if you're working out with someone, you can enlist their help to kind of hold your feet down. And we're going to go ahead and do 3 sets of 10 sit-ups for this exercise. You're going to place your hands behind the bottom of your head, and when you sit up, you're going to push your chin straight up to the ceiling. That way you get really good form. So let's go ahead and get started. All right. Our next exercise is going to be the bicycle. For this, we have the similar position as the sit-up, but we're going to lay flat on our back with our feet at a 90-degree angle as we move our legs as if we are riding a bicycle. We're going to do 2 sets of 30 seconds for these. Let's go ahead and get started. Our next exercise is the plank exercise. This exercise is really going to help with your core muscle and core muscle control. For this exercise, you are going to be on your stomach. You are going to have your elbows nice in front of you, and you're also going to have your feet on your toes behind you. We're going to push up in the plank position and hold this position for 15 seconds, and we will do this 2 times. Let's go ahead and get started. Our next exercise is going to be the bridge, or what we call hip extension. And for this exercise, you will be seated on the ground with your feet flat on the floor. Our backs are also going to be flat on the floor, and we're going to lift our hips up to the ceiling. For this exercise, we're going to do 3 sets and hold them for 10 seconds each. Let's get started. Place your hands flat on the floor and place your feet about hip width apart. And when you're ready, we'll go ahead and lift straight up. So for our next exercise, we are going to do tricep extension. So you'll see that we do have weights here, but I want you to know that this exercise can be done without weights. You can use anything that you have at your home, such as a coffee mug or a can or anything that you have to just give a little bit of weight. And if you don't want to use weight at all, or if you have any kind of restrictions to this, you don't have to use weights, but we are going to use them for the purpose of this video. So with this, what we're going to do is hold this weight in our hands. We're going to place our arms back behind our heads with our elbows pointing straight up to the air, and then we are going to extend. We're going to do this 10 times, and we're going to do it for 3 sets. So let's get started. Our next exercise is going to be the bicep curl. Again, we do have our weights here, but the bicep curl can be done or modified with a can or a coffee mug or anything that you have at your home to give you a little bit of extra weight. This exercise can also be done without any weight at all by simply just moving your arms to get that mobility in your joints. Now, we will be demonstrating single bicep curls, but you can also do a double bicep curl where you hold your can or your weight in your hand and you simply move up and down like this. So there are many ways to modify this exercise but still get the benefit. We are going to do 10 curls on each arm. We're going to start with our right arm first and then move to our left arm. So let's go ahead and get started. Awesome. Switch arms. Very good. Our next exercise is going to be the jumping jack. We're going to do 3 sets of 10. Let's go ahead and get started. Ready? Go. Now it's time to cool down, and this is a very important part of any exercise as it helps your body recover from the exercises that we did previously or in any workout that you participate in. So now we're going to start with the abdominal stretch. For this stretch, you are going to have your hands flat on the floor, your elbows about shoulder width apart, and we're going to push up to stretch our abdominal cavity. And what we're going to do is stretch for about 10 seconds and do this 3 times. Let's go ahead and get started. Okay? Now. And again. Our next cool down stretch is going to be the sit and reach. So for this, you're going to sit on the floor with your feet straight out in front of you and try to pull your feet back to your knees so they're kind of at a 90-degree angle or a little bit more, so you feel that stretch right in the back of your legs. We're then going to reach to touch our toes, and we're going to hold this stretch for 10 seconds, and we're going to do it 3 times. Ready? And relax. And again. And relax. And again. And relax. For our final cool down activity, we're going to breathe in for a count of 8 and breathe out for a count of 8. For this activity, you will sit on the floor, and if you can, cross your legs or just in any kind of comfortable position that suits you. We are going to breathe in, and we're going to raise our arms above our head, and then we will count to 8, and then we will breathe out and bring our arms down for another count of 8, and we'll repeat this 3 times. Let's go ahead and get started. Go. Breathe in. And breathe out. Breathe in. And breathe out. Breathe in. And breathe out. Awesome job completing this workout with Knockout Diabetes. As always, we want you to
be well,
stay healthy,
and stay the course as we
knock out diabetes.
Happy day. I'm Dr. Paula Newsome.
And I'm registered nurse Tracy Young.
And together we are the educational faculty for our program,
Knockout Diabetes,
where the K stands for knowledge, N stands for nutrition, O stands for ocular health, and C stands for coaching. Today we are going to be sharing some information on medications that are used to better manage people with diabetes and also with pre-diabetes, and also just some strategies for monitoring this condition.
Absolutely. So some of the questions we ask are, how do the medications work? Do you know how the medications you've been prescribed work? How can you be a better steward in taking your medications as they're prescribed? And also, how do you feel about taking the medications?
So sometimes we want to beat ourselves up about how we got to this place. I mean, how did that happen? But sometimes it's really through no fault of our own.
Absolutely.
Sometimes it just is what it is. And as we say, it's the isness of it. So we want to make sure that you're aware to be careful, especially as it relates to selecting unhealthy food options, because unhealthy food options can cause our blood sugar to go up.
Absolutely.
And we definitely don't want that.
Right. And that can make a really big difference in how your provider prescribes the type of medications. So for instance, for hyperglycemia and type 2 diabetes, we have different medications that will work on different parts of the body to help manage that. So for instance, in your secretion of glucagon, which is going to be coming from your liver and how your pancreas is working together, there are different medications that will work on those receptors. So for instance, you might hear a GLP1 receptor or a receptor agonist. You want to be familiar and ask these questions when your provider is prescribing medications. What does this mean for me? How does this work on my body? And what happens if I don't take the medication as prescribed?
Or in some cases, that medication may not be the better one for you.
Correct.
And you may have an adverse event or an adverse reaction to it. And so you need to know what some of those things are as well.
Absolutely.
So understand that the way I like to think of, and this is really not type 1 diabetes, but this is with type 2, is that there is a progression of diabetes. Normal fasting blood sugar is less than 100 on a meter. A random is one that's taken with no regard to whether or not you've eaten or not, should be under 140, and your A1C should be 5.7 or less. Now, in terms of pre-diabetes, your fasting blood sugar should be, or fasting blood glucose should be between 100 and 125. Your random, again, with no respect to what time you've been eating or not, should be between 140 and 199, and your A1C should be between 5.7 and 6.4. What this typically indicates in a person with type 2 diabetes is that you've got roughly 50% of your pancreas still working. Finally, in a person with diabetes, your fasting blood glucose is 126 or higher. A random is 200 or higher, and your A1C is 6.5 or higher, which typically indicates that you've got about 20% of your pancreas working at that time. I just want to say how many people I've seen in my practice whose blood sugar has been, whose A1C has been 10, 11, 12, 13, and they were still walking in the environment. So if you have a positive family history, if you are super thirsty, if you are super hungry, and if you are going to the restroom a lot, and especially at night, do check your blood sugar.
Absolutely.
Also, one of the other areas that are impacted is your vision. In fact, you know, just a point of reference, I was able to have my father start seeing his primary care physician because his eyes started to change, his vision started to change. And that's another tip off that your blood sugar is out of control.
That's right.
For that reason, I just wanted to share those things because sometimes people will walk around and they'll ignore the obvious.
Those signs.
Yes.
That's right. Absolutely. So one way to identify insulin resistance, you know, which is kind of what we're talking about for type 2 diabetes, is there are definitely signs. So those cravings, you're hungry, you're craving for sugar. Are you really tired after your meals? Are you having any kind of migraine headaches? Are you having any kind of pain? That abdominal obesity where your abdomen is, you know, you're very round, and we're not just talking like, oh, I'm a little full, right? Having extreme abdominal obesity. And all of this can, if you have high cholesterol, high triglycerides, things like that can attribute to insulin resistance. And so kind of ask yourself those things.
If you have polycystic ovarian disease or syndrome, that's also a risk factor in developing diabetes, or even if you have a hormonal imbalance. So you want to make sure that you are getting checked on a regular basis for that. Make sure that your blood sugar is being managed.
All right, so what are some things that can cause insulin resistance? So we can have insulin resistance from your liver, or also from your muscles. So a high fat diet, something that's between 40 to 100% of fat, that's something that can cause insulin resistance. And also having a high fat or sugar or sucrose diet as well.
And by sucrose, you mean artificial sugars. Sometimes people don't understand when they're reading labels that that's a sugar. So
it's the OS.
Yeah, okay. So one more time.
The OS will tip you off. So your sucrose is a artificial sugar, and anything that's ending in OS, like lactose, glucose, those are going to be your sugars.
Yeah, sugar alcohol. All right, so there are several medications that make your body more sensitive to insulin, to allow insulin into the cells so that the insulin can allow the cell to do what the cell needs to do, and that is produce energy for the person. And one of those is metformin, and metformin has a ton of names. And so glucophage XR, Riomet, Glumet Zeta. Those are some of the names for metformin. But metformin is probably one of the most prescribed medications for diabetes throughout the world.
Absolutely.
It's been around for a long time.
It has.
And it's fairly inexpensive.
It's also an oral medication, so it's an oral anti-diabetic medication, and something that is typically kind of the first line that is prescribed for someone with type 2 diabetes. And it can work in two ways. So it can decrease the amount of glucose that the liver produces. So the liver is producing glucose, and metformin will help suppress that production. And then it can also help the fat and muscle cells use insulin better.
So the maximum dose for metformin is roughly 2,000 milligrams per day. However, most people usually stop with 1,000 milligrams per day. And the usual starting dose in kids is about 250 milligrams. In adults, it's 500 milligrams. And you always want to take that with the first bite of a meal.
Absolutely. Metformin does sometimes come with the side effects of, maybe some GI upset.
Before starting the medication, and your provider already knows this, you want to check your kidney function. And one of the things that's kind of good about metformin is that you can have weight loss up to about 10 pounds. You typically also have an improvement in your triglycerides and in your LDL going down, which is what you want. Your total cholesterol also going down about 5%, and about a 2% increase in your happy HDL.
That's right. Absolutely.
Metformin has also been linked to having some neuroprotective benefits as well. So in terms of protecting nerve function, especially as it relates to the eye. And also they're looking at metformin now for Alzheimer's. And seeing, because it's an anti-aging agent, and so they're using this now in some clinical trials to see how metformin is doing in terms of delaying the onset of Alzheimer's.
That's amazing. So as we talk about a little bit more side effects, I mentioned GI upset earlier, but you can also have nausea, cramping, maybe a feeling of being full or fullness, but these side effects do usually subside after about 1 or 2 weeks.
What about diarrhea? Can you get diarrhea
You
too?
can. That's a part of the GI upset, so like gassy, diarrhea, things like that. So you'll experience some changes, but you do want to give the medication time to work because your body is getting used to something new that you haven't put in your body, and so it is expected that you will have some.
This may be a good time to try some ginger, just to kind of circumvent some of that GI upset. But also, metformin has been linked to a metallic taste in the mouth.
Yes.
So you may also have that. So just keep in mind that anytime you take anything that is synthetic, that is not made from God, that you may have some side effects associated.
Absolutely.
Next class of drugs are the TZDs, and this would be your Actoses and your Avandias, and these used to be a lot more popular at least 10 years ago than they are now. There are a few people who are still taking these, but not so much. And they work by making your fat, your muscle, and your liver cells use insulin better. The one thing about this class of drugs, however, is that it takes anywhere from 8 to 12 weeks, so we're talking 2 months to 3 months before you can see any results. So if you've got a 13A1C, you're probably not going to get Actoses first line.
Right.
Because it's going to take another 3 months before you that blood sugar goes down.
So the starting dose for TZDs can be anywhere between 15 milligrams up to about 45 milligrams. And, this is going to be something that you work with your healthcare provider on which dose is best for you and how do you need it to work. So you need to have good liver function. So making sure that your provider is taking those labs before you get started on this medication.
Absolutely. And there were 2 side effects that were in the news on this, Tracy. Bladder cancer with Actose, and then Avandia was linked with increased risk of heart attack. So again, as I was mentioning to you, people seem to be prescribing this less and less, although I still have a few people who are still taking these medications. Also be aware that this class of medication can cause weight gain, which is not good. It can cause edema of the ankles, the legs. It can also cause a shortness of breath, and any of those side effects should be reported immediately.
To your provider.
Well, it should be reported immediately because you may be having a reaction and you may need to come off.
Absolutely.
Also, any stomach or muscle ache should be reported for that class of drugs.
The next class of drugs we're going to talk about are the DPP-4 inhibitors. And so these are going to work by inhibiting the action of enzymes on your GLP-1 receptors. And basically what that means is this is a response produced in your intestine, and it stimulates the pancreas to produce insulin after a meal. So what the GLP-1 also helps with is lowering the amount of glucose that is released by the liver. And that's very important. Just we were talking about the metformin also has that same effect, but with the DPP-4, it's going to also have that effect on your pancreas.
Good.
So moving on to our next class of drugs, which is the SGLT2 inhibitors. Now, these medications are going to work by blocking the reabsorption of glucose by the kidneys. So the kidneys are also a filter for us. When you eat, anything that's going through your body, the kidneys act as that filter. And so these medications are going to block that reabsorption.
Can I just add that if you look at the generic name of all of those drugs, think about all of them have the word flow in there. So you think about the flow with the kidneys. And blocking the flow.
Blocking the flow. That's a very good way to remember them.
Yeah.
They also increase the secretion of glucose throughout the urine, and they're going to decrease that blood glucose level that way by flowing out, right? It's going to get rid of it. And then some of the side effects you might see with these are dehydration, and which makes sense because if it's coming out through your urine, that means you're excreting some of that fluid, and so it could cause some dehydration and also an increase in your LDLs.
Do you know that 70% of people in the United States walk around in a dehydrated state? And so if you're taking an SGLT2 inhibitor, that is just adding to dehydration. So the point is to make sure you hydrate. And the best way to hydrate is with water, either with lemon or whatever your favorite fruit is in it, but water, water, water,
Absolutely.
and more water. So let's now talk about insulin, because and people sometimes think that insulin is a death sentence, but insulin is actually a way of life, and it is actually a lifesaver.
Absolutely.
To many people. But the thing about insulin is there is a basal insulin, which is a baseline incidence, and then there is a bolus. Bolus refers to after you eat. So it's shorter acting versus the long acting. And so typically when you're taking insulin, you have to take two forms unless you're taking a combo.
Absolutely.
But that's still two forms.
It is.
But you can't take the two forms together.
Types of insulins. We have rapid-acting insulins, intermediate insulins, and long-acting. And our rapid insulins are going to be those insulins that have a very quick onset, they have a very quick peak, and they don't last as long. And to remember some of those, you might hear the ending of log, Humalog, Novolog. Those are your rapid ones. And then we also have regular insulin to go along with that. Our intermediate acting insulins are like your MPH, and what these are going to do is they have a little bit of a longer onset, a little bit of a longer peak, and then they last longer in your system. And then your long-acting insulins like Detamir, Levemir, Glargine or Glargine Lantus, those are some of the names that you might hear. They are going to actually not have a peak, and they're going to last for a lot longer.
So those are the ones that you get at night to take you through the course of the night. And then there are inhaled insulins. There are insulins that you can use that actually work, but they are also pretty short acting. But they are good for people who are afraid of needles.
Absolutely. And that's a good thing to ask yourself and ask your provider, because if you're taking insulin, you will have to give these injections yourself. And if you're afraid of needles or things like that, you definitely want to address that with your healthcare provider and getting some education on how do we do this, how can I, demonstrate back to them before you leave, so that makes sure when you get home you're giving yourself the medication correctly.
Also, though, there are newer methods of delivery, insulin delivery, that they're working on now. So you don't have to give yourself all those injections as well. But we'll kind of talk about that in just a second. Do you want to share about the GLP?
So the next classification of medications we'll talk about are the GLP1 agonists. And you must have a BMI of at least 30 or between 27 and 30 in order to get on these, because weight loss is very common with these. So they are intended for those that have type 2 diabetes, but it does not replace insulin. They give a very feeling of fullness. It leads to eating less and weight loss, and so that's why your BMI has to be in specific parameters.
Right. They're actually using a form of this as a weight loss agent. So, would you like to share some tips for testing your blood sugar?
Absolutely. So here, and this is by the FDA, we have 7 helpful tips for you to test your blood sugar. One is to read the directions for the meter and strips before you begin. All meters and strips are not made the same, so you want to make sure that you have the right equipment in the right directions before you start. Wash your hands. It might seem like something very simple, but you don't want to introduce any kind of bacteria into the site that you were taking your blood sugar from. Or viruses, correct, none of that. And then make sure you use the right test strip for the right meter. So if you've made any changes in your meter, make sure that you have the strips to match so that you get an accurate reading. Write down your results, very important. Write down your results with the date and the time. So this tracks your results and you can kind of identify any patterns that you may be having. And then clean your meter as directed. Glass cleaner, ammonia, and other products like that may actually damage your meter. So make sure that you're reading and following the instructions on how to clean it properly. And talk to your healthcare provider about your medicines and how they will affect your blood sugar. Other medications that you have or any other solutions, just anything within your regimen could make a difference on your side effects. So make sure that you're always in touch with your healthcare provider about that. And then number 7, take your meter with you when you go to the doctor. This way you can test your blood sugar in front of your provider or the nurse, and doing it right away, so your healthcare provider can maybe print out your results or make sure that you're doing it correctly and that you're getting an accurate measure with that meter that you're using at home.
And nowadays with apps and all of that, some of the writing down and some of the laborious testing in terms of injections and all of that can be circumvented if you are able to change your method of delivery.
Absolutely.
In terms of,
technology is our friend in managing diabetes, for sure. There's a lot of resources out there, so if you can shy away from the old school pen and paper, there's some ways that you can take this stuff on the go with you very easily.
Absolutely. And so now at this point we want to share our 10 for 10 pledge. We want you to monitor your vision daily.
We want you to monitor your food intake daily.
We want you to monitor your blood glucose daily.
And keep up with your program materials.
We want you to write in a journal when you're feeling in control and also out of control, making sure that you're writing down who, what, when, where, why, and how.
Absolutely. And be open to change behavior. Where are you on that change continuum?
Instead of always having to do things the old school way by writing them down and by giving yourself injections, maybe you can do something a little different.
Absolutely. Check your feet daily. Make sure that you take a mirror, look under there, maybe have someone that you live with, a close friend, a spouse, if you're unable to check underneath your feet due to mobility or any other restrictions, make sure you're checking and you see any changes that's going on with your feet.
Do at least 150 minutes of physical activity per week, and that's only for maintenance. If you want to lose, you really need to expend at least 240 minutes of time per week exercising, and that's physical activity. It doesn't have to be as strenuous as running. It can be as simple as walking.
Absolutely. And make sure you attend at least 80%, get at least 80% of this information, whether it's watching the video or coming into the classroom.
And we also want you to fully participate in the Knockout Diabetes activities, because we want you to be well,
stay healthy,
and stay the course as we
knock out diabetes.